Anyone who's speaking, I just want to warn you that there's a short cord up here, and I thought we'll script on it twice. Just be careful. You don't want to do that. Good morning, everyone, and welcome. Thank you for attending this morning for the awarding of the EmergyCare Multi Municipal Collaboration Grant and the release of the ECGRA Emergency Services Report titled A Lifeline for Erie County. We're gathered here at EmergyCare to award a $100,000 grant for a new ambulance. This will be used to support life-saving measures and continue a standard of care in all of the communities that EmergyCare serves. Recent grants, including this one, got us thinking about the EMS crisis as a whole and the role that ECRA is playing to solve the problem, to help solve the problem, I should say. Pennsylvania's emergency management systems have been under strain for more than a decade as the landscape around volunteerism, limited resources, and aging equipment have collectively forced a shift in this vital segment of the public safety sector. Locally, aid, municipal, and mutual aid EMS have begun to cover broader areas across Erie County. Chronic understaffing and the aging equipment are two areas where mutual aid partnerships are lifting the burden and reducing risk to response capabilities in the public. EmergyCare is just one of the organizations of many across the county facing challenges that ECRA is stepping up to provide monetary solutions to. Sustainable EMS systems are built when municipalities communicate, cooperate, and commit to shared responsibility. ECRA grant funding is providing critical support. After meeting with leaders across the county, we've begun helping EMS agencies bridge funding gaps when investing in essential equipment, strengthening their ability to meet growing demands, and maintain emergency services all across Erie County. Our own records determine that ECRA has invested over $4.8 million in emergency services, and when combined with matching funds, that's over $10 million invested in a critical area of Erie County. This latest investment highlights the countywide impact of ECRA EMS grants, especially when mutual aid calls are considered. For example, an ambulance from West County paramedics could pick up a patient in Cranesville and transport them to a hospital downtown. On the way back, the crew can then receive a mutual aid call in the city of Erie. This is the legal obligation of a dispatched ambulance. Hence, combining funding with good public policy, we see the power of collaboration, cooperative equipment purchasing, and the legal context effectively regionalize EMS services across the county. Early and accessible funding from ECRA has been critical to this success. Since 2015, ECRA has provided matching funds to support ambulance purchases and replacements, strengthening emergency response while keeping dollars circulating locally. Programs like the Harbor Creek Township Emergency Response Team, the HCERT as it's known, have only improved safety, not only improved safety, but generated an estimated $300,000 in revenue for local departments. These funds are then reinvested directly into community protection. ECRA is Erie's impact investor. We strategically deploy local share gaming revenue to empower municipalities, nonprofits, and regional partners to meet real needs with practical solutions. These investments are transparent, they're accountable, they're measurable, and in the case of EMS, they are quite literally saving lives. The Multi Municipal Cooperation Grant, launched in 2012, was designed to catalyze functional cooperation among Erie County's municipalities. East County EMS's approach shows how ECRA Multi-Municipal Collaboration Grants paired with local leadership can solve regional challenges. We encourage people to read the full public safety report with more details on ECRA.org. Once again, you can see that on www.ecra.org. and we'll have printed copies available for you here today. Before I turn it over, I just want to say that a day like today can't happen without the cooperation of three groups that come together to make a day like today successful. The first is the ECGRA Board of Directors. Representing the board here today is Angie and Angelo. Thank you so much for being here. We have a 7-member board of directors that represents the 7 districts of Erie County. It's brilliant because you get geographic representation, you get population representation, and you get to, you have deep reach throughout Erie County. And for a group like EMS, that's really important. The second group is county government. We have a lot of folks from county government here today representing the county executive, of course, Christine Holt is serving on the here in a second, but also members of council. Chairman Scutella is with us, Chair Scutella. Chris Drexel is in the back, and June Wertz, newly elected Councilman June Wertz is with us. We really appreciate the support that comes from having county government have our back and make sure that we can continue to do our job. The third group that's really important in this is the state of Pennsylvania. Leaders like Ryan Bizzaro and Pat Harkins representing us down in Harrisburg, they make sure that gaming legislation is set and appropriate so that the funds flow here locally. And that's where the concept of local share gaming revenue comes from. So to talk a little bit more about the county's role in this, and we appreciate all your support, I want you to join me in welcoming the newly minted county executive, Christina Holt. Thank you.
I'm trying not to fall. I just have a few brief things to say. One is that, no matter where you live across the county, whether that's in Fairview where I live, or Union City or Harbor Creek, if you're calling 911, you want someone to come and show up and be there. And I've said multiple times that the county is about people, and when you're in your most critical time, that's what you need, right? And so however we can support the EMS situation that's happening and the crisis that we see going on, I'm happy to do that. The other thing is that now that I've been in this role for a whole 3 weeks, the magnitude of the job is extensive. And to have partnerships with organizations like ECGRA that do the research and that fund some of these issues that happen throughout the county is really critical. And I will tell you, everywhere that I've been across the county, I see your flags. And so I know you guys are everywhere, and I really appreciate everything you guys do. And also county council that have the foresight to really be a part of this. So thank you all. Congratulations on EmergyCare, and thank you very much.
Thank you so much, County Executive. I think I join many of my colleagues in saying that you are breath refreshing. I also want to have the other branch of county government come up, the legislative branch, and say a few words. We're honored to have Chris Drexel. There I go, Chris.
All right, so I'm not going to speak down to the microphone. I'll just speak really loud here. So I live in a district that's greatly affected by the CMS crisis, and going throughout the county and speaking with other districts, the different firehouses, talking to them about this has been at the top of the list since I started to run for this position. And I'm so thankful that I've been able to partner with ECGRA and be able to help them with some funding along the way here. Everybody's touched on how important it is. Like, you pick up the phone, you call, you want to be able to have somebody that shows up, for that. A lot of these things, it's, this money coming in, it's about the equipment. I was talking with Fairfield, so Jim Harlow's picture was up there. They have an ambulance that's stuck in New York, right? It needs like $60,000 in repairs. Corey had attended our meeting just this past week, and they have the same type of trouble with equipment. A lot of these things, they're working together in collaboration to, try to handle these regional gaps with East County and West County for the EMS programs. And I think it's crucial that they continue to do that. They're learning from each other, and it's starting to work, right? So, for us, anytime that we can, partner with ECGRA or somehow uncover funding and be able to help in this process, more than happy to do this. Very proud of the work that's been done. Almost $5 million, and you're looking at the map getting the 10 minutes. We're very excited. So congratulations to EmergyCare. Really appreciate it. Thank you, Mr. Wood.
Thanks,
All right.
Councilman. Appreciate it. Thank you, Councilman Drexel. Really appreciate you. What he said was really important too, which is that members of county council talk a lot of time about the issues affecting their district. They're able to step in. Councilman Drexel is fantastic. Able to step in and talk to various stakeholders in his community to make sure they take advantage of these funds. But also, when there's a dust up, he's able to step in and settle the dust too. So it's always nice to work with. Okay, bringing us back from Harbor Creek to the city, I do want to recognize Mary Wassel, who's here from the mayor's office. Mary, thanks for being here. And that brings us to our recipient today. EmergyCare is the brand in this area. It is the beast. It is the 800-pound gorilla when it comes to EMS services. It's quite a professional operation. Dave has given me a tour. It's amazing what you guys do down here. But I'll let him talk about all that. Please join me in welcoming Dave Besson.
Well, good morning, everyone. Welcome to EmergyCare. It's an honor to host such a broad group of elected officials and providers of emergency medical services in this part of the world. Today's an exciting day for us because our mission since we started July 1st in 1983 has been about serving the public. EmergyCare has faithfully served the city of Erie and the county of Erie since that inception, July 1st in 1983. It's 42 years old. It's 10 months older than I am. That was something extremely intimidating when I took over this position, taking over something and trying to live out the legacy of those that came before me. And myself and my staff work very hard to do that every day. To the tune of, we respond to over 25,000 incidents in just Erie County alone. System-wide, we respond to over 72 to 73 requests in our footprint, northwestern Pennsylvania. What we've seen, and everybody's tired of hearing about the pandemic, but we've seen significant increase in costs. And so that's where partnerships such as with ECGRA and other grant funding programs is essential for us to continue to provide service at the level that we do. Here at EmergyCare, we really pride ourselves on remaining on the cutting edge and being the leader in emergency medical services in northwestern Pennsylvania and also in the state of Pennsylvania. Everything that we do here and all of our staff focus on our mission here to save lives and positively impact the health and well-being of the communities that we serve. That is the forefront of all nearly 280 staff that come within our organization in a time period to come make an impact to those communities. And so I would be remiss if I could not give a shout out to my staff and everybody that comes to this job every day, day and night, while people are sleeping in bed, while there's 5 feet of snow on the ground. They're the ones that really make it happen every day. I might be the one that's standing in front of you today, but they're the ones that make it happen. But the reality is that people are our greatest resource that we have. However, having equipment ready to go to put those people in, safe equipment, cutting edge equipment, is key. And that's what this $100,000 is helping us with. We have a fleet of over 40 ambulances. The pandemic did step back production and slow down production with ambulances. Now we're on a very aggressive replacement schedule now that we've started to come out of that. We just recently made $1 million investment in taking delivery of 40 ambulances. The next 2 are due within the next couple months, and that's what this $100,000 is going to go towards, is help replace that equipment. By having that ability to offset some of those expenses with the additional funding, we're able to reinvest in people, whether that's in wages and salaries, equipment, or cutting-edge programs, which we have a lot of exciting announcements to make in the coming months. I don't want to say too much about that now, but please stay tuned. So, EmergyCare, there is not one district in Erie County EmergyCare does not touch in some way or another. Everybody. We will go, when somebody calls for help, we will go regardless of who they are, where they live. If we're needed, we will go. We will deploy and do everything that we can to better those communities, even when they're not our primary response area. I do have to thank the city of Erie, who helped us with this grant, with a letter of support, the city of Erie, the surrounding municipalities around the Erie area as part of our primary response area. But like I said, as Perry talked about earlier with mutual aid, we don't view it as mutual aid, we do it as the right thing, because that's our mission. Our mission here is to take care of people. It doesn't matter where you are, who you are, where you live, it comes down to people. So we are excited and look forward to taking delivery of these new trucks in the coming weeks and see them on the road. One of the newer ones we do have in the garage, so please feel free to stop down and take a look. You can also see the new stretchers we've recently invested in, nearly $2 million worth of new stretchers. Things load themselves, all this stuff that I wish I had when I started 25 years ago. It's finally coming to fruition, but it's pretty neat. If you've never seen them, please stop down and take a look. So, but it's partnerships like this that will help solve this crisis. And quite honestly, ECRA, county government, has no legal obligation to do any of this for EMS. There is no legislative action that says that the county of Erie or an authority such as ECRA has to do something like this for EMS. They are doing it because they have identified that this is an issue, this is a shortfall, and this gap funding is needed to help keep taking care of people. And so I thank the ECRA board, I thank Perry Wood for their support. You know, this is sort of a historical moment for EmergyCare and ECRA, and we're excited to be partnered together and look forward to working together in the future. Thank you.
Well said, sir. Thank you so much. Thanks for hosting us, and congratulations on the $100,000 grant. I was going to read the list, but instead, I'll skip it. Yeah, you got that. But I did want to say this is the report. A lifeline for Erie County. There's a copy here for all of you to take a look at. $4.9 million worth of investment toward helping to alleviate the EMS crisis that exists in the rural environment. And it's all over Erie County. Every municipality in Erie County is touched by it. So please get a copy of it or visit ECGRA.org to download a copy of it. This will be available. And I just want to point out there's a great picture of me on this paper here. So you can see. we got my best side. That's great. They actually had to powder me down just because the flare was too much. All right, jokes aside, thank you so much for hosting us today. I really appreciate it. This is a truly great day, and I look forward to many more days like this when we can help EmergyCare out as well. What we'll do is what we normally do at conferences now. We're going to ask you all to come up and pose with the staff at EmergyCare and all the guys in the back. I do want you to come up and be a part of this. The big fake check photo. It's an effort tradition. We're going to do it. And then anyone who can stick around, we're also going to tour that ambulance that they mentioned that the funding came from. I'll take two for stuff person. So thanks so much for being here. I appreciate it.
If I can interject really quickly too, I'm sure all you guys want B-roll of the ambulance and everything, so we'll go right down and do that.